Okay, this video is going to demonstrate case 2, and so go to File, go to New Project, not Open Project, but New Project, and start from Patient CT Scan. And I'm going to go to where I have these files stored. It may be different on your computer, and this is case 2 DICOM zip. Click Open, and OK, and the software is going to open up the case. And again, you want to limit the field of view. I'm going to maximize this. Occlusal plane already looks parallel, so I shouldn't need to grab the rotation ring, but in this case we're going to bring this in. I don't need the spine in this, so that looks good. Now I'm going to OK it. And here you can see the result. We've got the 3D rendering down here, and as always we want to go ahead and start the case by getting all of our views correct. So you'll notice that right now the computer is cutting off these molars, and again that's a function of the panoramic curve. So first thing I always do is I set my panoramic curve. So I'll drag this to the full extent of the mandible just by grabbing the node, left click and drag, and now I can see the full mandible. Now the next thing we'll want to do for a mandibular case, we're going to be placing implants right here, is that we want to map the nerve. And so to map the nerve, I've shown in video 1 or case 1 how to do the automatic way. That's easy enough. I don't feel it's necessary to review. So let's review how to do manual nerve mapping. So click on this black and yellow button, which is to switch from the composite view over to the slice view. And when I do that, you'll see that now this panoramic curve changes into just a panoramic slice. So what you'll do is grab each of these nodes individually until you see the canal coming into view. Once you see that, grab the next one and position it. And so you'll do a little back and forth here to try and get all these nodes where they're following exactly down the canal. Work your way towards the foramen. And right there you see the full extent of the canal. So do that before trying to map the nerve. Once you have this where it's visible, click on plus nerve, and it should be ready to start dropping points. So I can left click, left click, left click, left click, and I'm going to just go all the way up to the foramen. And as I approach the foramen, I'm slowing down. Okay, so when I see right there that it appears in my cross-sectional window here in the upper left, now I'm going to click my way out of the foramen. So once at the mouth and one more time out in space. And now we are done. If you click anywhere else on the screen while this tool is active, it's going to continue dropping nerve points. So you need to come over and deactivate this red Edit Nerve button. And even now it can be modified still. So if I wanted to grab any of these nodes and fine-tune the positioning, I can do that. But that is looking nice, and so I'm going to lock it. The little padlock button right here in the nerve list will lock the position of that nerve so that now you won't mess that up. You can see it here in the 3D rendering. Now, the other thing that we need to consider, we can go back to the composite view, is just an overall treatment planning consideration. So if you look at this case, you see you've got a third molar which is extremely tilted over. You could potentially place 2 implants in this space, but what's going to happen is the patient is going to have a really large food trap right here. That tooth is unopposed, so really it has no value in being saved. Now with that said, we do intend to extract it, but there's value in keeping that tooth until after the guide has been fabricated, because you would always rather have a guide supported by hard tissue rather than flopping up and down as a distal extension on soft tissue. And so in this case, what we're going to do is plan on coming in and just maybe removing this half of the tooth so that it's not in the way of placing the implants properly, but maintain this distal portion of the tooth to support the surgical guide. And then once the osteotomies have been made and the implants placed, you could finish out the extraction here. So that is the plan. I've already got the nerve mapped. Let's go ahead and isolate the jaw. Actually, let's go ahead first and bring in the STL model. So File, Import STL model. This is going to be case 2 DICOM zip. or I'm sorry, case 2 gingiva. You can see it right here. And the software is going to default to this matching teeth function. Now, I'm just going to skip this. This is something I often do because I just find I'm quicker to do it the manual way, so I just cancel out of this. And you'll see I have the STL in the case, but it's not stitched, okay? So what I'm going to do is first isolate this jaw just to get rid of these little artifacts and cusp tips that are floating around this. That is done in the surfaces panel. So surfaces, and I'm going to select the CT surface and isolate. Once that button is red, just click on the mandible and it should isolate that. Very good. Now to stitch it, go to Panels, Model Manipulation, and we're going to choose Points and Align. This is going to bring up the window where you have the CT scan on one side, the STL model on the other side. And this is also where we need to be very, very specific in the points that we're choosing. So maximize this so that you've got the biggest view possible. And you're going to notice some differences between this one and case 1. Case 1 was extremely easy to stitch because there was no restorations in the teeth. Everything showed up nice and clear. With this one, you can tell that with the metal artifact in this patient's mouth, the stitching points are much less clear. So we have to get a little more nitpicky on how we choose the points. I'm still looking for distinctive marks like cusp tips, occlusal grooves, the incisal edges and wear facets. But sometimes with a tooth like this that's got a lot of metal, I may not be able to find a good stitching point. Okay, I like the cusp tip of that canine. And I should also mention, do you notice how, because we know we're going to need to get rid of that mesial half of the tooth, before this STL was created, we just used a burr to cut off the mesial half of that tooth. That way our STL matches what we're going to plan on doing in surgery. There's digital ways of doing that, but nothing beats a good old handpiece just to lop that piece off. All right. Continuing around my stitching points. And OK. So let's evaluate the stitch. Maximize this window. You can see the model outline. Sometimes if the screen is looking too busy, there's too many lines going on with it, this button right here is your All Projections button. It looks like a panoramic curve with a rainbow spectrum behind it. If you'll click that, that just turns off all of those projections. And so I'm scrolling up and down through this. That looks like a pretty good match. Obviously, where these teeth have all the metal scatter, it's very difficult to tell much from that. Let's also look in the cross section. So I'm scrolling through here, and this looks pretty good. Now, this is not perfect in my opinion, and why is that? Well, there's some clues that we can find in this case. So I know because I've done this case 100 times that I could restitch this as many times as I want. I'll never improve on this. And part of the reason is that you can see right here at the midline there's a ghost image. That is patient movement in the scan. And so I'll never get a better alignment with that. And so when you see that, you have to ask yourself, is that enough movement that it's going to affect the accuracy of my guided surgery? Is it far enough away from the site I'm going to be working on? Is it isolated to one area and then the patient got back in the right position? I find this happens most often right at the midline where the tube head is circling their head and then they get hit in the back of the shoulders, and then oftentimes as soon as it passes they're back in position. So in this case, I've done this enough that I trust the stitch that we've got, and so I'm going to go ahead and go with it. Open your surfaces panel at this point. You can turn off the visible on the CT model and just look at this cleaner STL model. Now we need to add teeth. So plus tooth, I'm going to be adding the first molar right here, and also a second molar. And now I do my positioning in the 3D rendering window. And I'm just using the widgets to drag this around. Again, if you hover on the actual tooth, just click on the red of the tooth, it's going to bodily move this. If you hover on the rotation rings, it's going to rotate it in whatever plane you're centered on. And if you need to make a tooth skinnier, we can do that. So that's looking pretty good. The ideal way of doing this would be to do an actual CAD/CAM proposal where it takes into account occlusion and everything, but I find 95% of the time this is perfectly sufficient. So I'm going to go with that. Now I need to lock the teeth, right click, lock, right click, and lock. This way, every time you hover on the tooth, the rotation rings aren't coming up. Okay, so now that the teeth are there, we're ready to plan implants. Plus implant, I'm going to choose a Biomax 4.3 by 10 in the mandible, and I like to add an abutment, and I choose a custom abutment that is 20 millimeters long. The only purpose of that is to help visualize my emergence profile, and I can left click in any of the screens to put that into position. Alright, so I almost always use the tangential window up here in the upper right to do my positioning. Okay, so while it looked great from the buccal, obviously it needs to move over into the ridge. Now, a lot of times what I'll see people do is they'll have it positioned in some way like this. One thing I can tell you is that you're drilling through cancellous bone on this side, and you're really going to be fighting this cortical bone on this side, and it's going to want to make you deviate. So I just generally try to avoid that from the start, and I place it into cancellous bone. That way it's going to ride down this cortical plate nice and easy, and it should make the surgery go much smoother without having to really force this implant or drill to go where you're wanting it to. Alright, so that looks pretty good. There are no warnings coming up about being close to the nerve. Everything's in bone, so I like that. Now, a quick and easy way to add more implants to a case, let's lock that. Is that you can right click it and say duplicate. Now when it duplicates, you notice that nothing else shows up other than this exclamation point. That exclamation point is telling you that there's implants sitting on top of one another. So if I unlock this, now I can grab one of them and just move it distally. Alright, and the cool thing about doing that is that it keeps those perfectly parallel. So you've got absolute parallelism between them. However, when I do that, it looks great from this side, but when I come to this side, I'm going to be perforating through the lingual. And so I begin having to ask the question, is it worth maintaining perfect parallelism and pushing it that close to the floor of the mouth, or should I give up parallelism, pull this over into the cancellous bone, which is what I would do, and positioning like that. I think you'll still see that that is a very good position. If you look in this 3D rendering, I'm more than happy to give up just that slight degree of parallelism to get those emergence positions and to be well within bone. So a very subtle change, but it makes all the difference in the world. Alright, so the implants are in position. We are ready to make the guide now. So first thing you'll want to do is turn off the teeth. The tooth button up here, just push that and the visibility of the teeth will go away. We'll also need to turn on guide tubes. So panels, implant list. And this would be a great case for the fully guided kit. So I'm going to choose the Blue Sky Bio fully guided surgical kit and turn the tubes on, which is this checkbox right here. Now this would not be a great case for the direct cut drills. Let's look at the direct cut drills. If I try to do the direct cut drills, the depth is controlled by placing or the handpiece bottoming out on these drill stops. Well, as you can anticipate, the handpiece is going to bottom out on these adjacent teeth first. So there are ways of dealing with that. We could come over to the make sure you're in advanced mode. I forgot to do that. We could come down in our implant list and raise up the offset. So watch this implant right here. I'm going to bump up the offset, which is also just where the tooth is vertically, or the tube is vertically. And it's giving me a warning. So it bumped it up, it got it up out of the tissue, and now our drill stop is higher, so we don't have to worry about bottoming out on teeth first. But now it's an access problem because it just kicked us up to the long drill. And so there's no guided kit that's perfect for every single scenario. Sometimes you're going to run into this situation if you're using the direct cut drills and this is your drill stop. It's an access problem. Or if you're way down there where it was earlier, now it's a problem of getting the drill to bottom out all the way. So maybe you have to guide until you hit the teeth and then just take it off and do freehand. The fully guided kit, though, since it's not depending on bottoming out on the handpiece, the tubes right here are going to be much more amenable to this space because you can just use your drills. The drills themselves have stops on them, and so access will not be a problem. So I'm going to lock these, and now I'm ready to make the guide. Go to your panels and open Guide Fabrication. We're going to build this on Case 2 gingiva. Lock the implants and teeth, use the automatic brush, high quality, on the mandible. Now draw the curve. So once draw curve is red, that means it's active. I can push the shift button, left click and hold, and begin drawing my guide outline. Once I get to a point where I need to stop, reorient the model, continue my line on, come up and over the teeth. And I'm not trying to make those lines start and end right on top of one another. In fact, I would recommend you don't do that. So just get somewhere in the vicinity and continue it on. And that should do it. Now edit the curve. And you can see here, that looks good. And just fine tune all of those, and now we look great. So the last thing is create surgical guide. And here you see the guide has been fabricated. If I want to change the color of that, it's in your surfaces panel. It's just listed now as another STL surface. I can pick any color for that. And this is the final guide. If you turn off the visibility of the STL model, you can see how this looks. Now, it's worth mentioning, you notice how the guide tubes were impinging into the tissue a bit. I'm often asked, is that going to be a problem? The answer is no. If I turn off the implants now, you'll see that the guide tubes disappear. So the software knows that that can't impinge into that, and so it's going to remove that. Pause 1 second for a phone call. Sorry, I had a phone call there, but what I was trying to say is that if you look here, as long as you don't export the guide tubes also, you'll see that the software will block that out so that you don't have tissue impingement with that. So this is the completed guide. We could minimize this. Again, you can use the text tool to emboss the patient's name on this if you would like. That would be done in the guide panel. You would simply type in the name or the implant size, whatever you wanted to do, and then position the model behind the text, and then click Apply Text. And then the only other thing you might want to consider doing is making the drill report. Now, as far as the parts that are going to be needed for this case, we can go to Panels and go to Parts Panel. And it's going to tell us which cylinder we need to use for this. These are the cylinders for the fully guided kit. Which kit, obviously you shouldn't have to purchase that if you've already got it. And then which implants. You can even add those parts to your cart. And if you're hooked up to the internet, it will take you directly to Blue Sky's website and add those to the cart. And you can simply X out anything that you don't need to purchase. So that's basically it for case 2.